Hey everybody, it's David Kemp, host of Highway to Health podcast, and thank you for being here. We've had a lot of great conversations recently about, the innovation, disruption, and early adoption of new technologies, new solutions in the healthcare environment, and how those are providing increased access to care, better experiences for the patients, and overall outcomes for our population's health. And I'm excited for this conversation. Hopefully you find it beneficial as well. We have the Chief Commercial Officer of Molecular Testing Labs, James York, with us today, where we'll talk about remote care, and we'll talk about what that means for the patients and how we can improve access and experience for those patients to get the information they need to make really good decisions about their health. James, welcome to Highway to Health.
Thank you very much for having me.
Yeah, thanks for being here. How you doing?
I'm very well. I live, 1 hour away from here, and I floated here in my car. It's raining so hard outside, but I'm very happy to be here.
Yeah, well, we're glad to have you. We'll get into work and business here in just a minute, but I like always asking executives that are on the show how you keep yourself healthy outside of work, whether that's mental health or physical health. I'm sure there's ways that you can escape, refresh, and stay ready to do a really good job for your organization. Share with us some of the things that you do outside of work.
Yeah, sure. As you can imagine, in a growing business, I don't get a lot of time. So I have to really make my time work. I spend time in the gym. I have a gym membership at Lifetime in Flower Mound and try to go there as often as I can. I've learned that my exercise routine needs to be more about function than strength. So spend a lot of time just on HIIT training and cardiovascular type things. And my escape is actually my children. I have 4 children. 2 of the children are boys that, as a dad who loves sports, I gravitate to their sports.
Yeah.
I still coach one of them in baseball. He plays very competitive baseball for a select team, and we do well. We have a lot of fun with that. And so at least 3 times a week, if it's a practice, I get outside and chase fly balls and yell at kids and try to turn them into men. If that's not it, then we're usually doing a travel tournament on the weekends. And then, Of course, my daughters are just gorgeous, been very blessed. And so the focus right now is just purely it's Molecular Testing Labs and its family.
Yeah.
And then, of course, we, try to eat well.
Yeah. Those kids, they'll keep you young and old at the same time.
Yeah, that's right.
I've got a son. I've got 2 sons, 2 girls, and so I can relate to that. We're at the baseball fields or the flag football fields all day, every day on the weekends.
Oh yeah,
and it's a blast.
Yeah.
So hopefully we don't get rained out this weekend.
I think that's likely.
It's probably going to happen. But outside, when we think about the healthcare industry right now, I want to get your take. I think you have a really interesting observation about innovation and disruption that's happening in healthcare and what's actually achievable when we talk about those terms. Because we know there are some challenges in healthcare that a lot of people have tried to overcome and to fix and disrupt. You have a really good take on what disruption truly means in healthcare. Let us hear your take.
Sure. So my take comes from just looking at data points in the market, right? So a really good example for us all to look at is Amazon, JP Morgan, and Berkshire Hathaway partnered up to disrupt healthcare, right? 3 of the most powerful companies with the most influence and cash in the US, and after a short time they disbanded and gave up on the disruption of healthcare. And so I think that that's a really good starting point to form opinions on about how to disrupt healthcare. And I'm not certain that disrupting healthcare is the right approach. How do you eat the elephant, right? One bite at a time. And so for our company, we're not necessarily focused on disrupting healthcare. We're focused on complementing care. And so all that means is that we believe that there's a really unique interaction in healthcare where part of it can be physical and part of it can be virtual, but the 2 halves come together as a whole to meet all patient needs in the nation. And so we're not necessarily looking at transforming healthcare. We're looking at being different in diagnostics so that diagnostics can be part of the solution to transforming healthcare. And we try to do it in a really achievable, like just a simplistic type of way. Most patients in the US, they access their healthcare through their conduit of health plan, right?
Right.
But if you're not employed, or if you have benefits that have really high deductibles, which is a really common story in the US right now, you're not going to go to a doctor and ask them, how much is it going to cost me for this diagnosis, right?
Right.
You're probably just going to avoid the encounter. And then if you have a condition where stigma is associated to that condition, you're even less likely to go and ask how much is it going to cost me for this encounter to find out if I have a condition, right?
Yeah.
So all we're trying to do is just change the access point to diagnostics. So innovation in our case is not looking at different gene sets and expanding our database on genes and what they do. Innovation for us is just expanding access to diagnostics. COVID happened in 2020, right? And it really changed the paradigm for what people were willing to do and what they felt convenience by doing, right? So if you went to a restaurant during COVID, you no longer got a menu, you got a QR code.
Right.
And it was taped to the table, and you had to get your phone out, and you either had to figure out how to embrace that technology of a QR code, or you had to ask the server, like, what do I order here, right? There was just a major behavior shift that occurred during COVID, and people all of a sudden got more comfortable by ordering their consumables off of a platform than they did going to the grocery store or to the supermarket, right?
Sure.
The same thing is happening in healthcare from my perspective, and that is it's inconvenient, especially for younger populations, which are the really hard to reach ones here, but it's getting really inconvenient for people to go to brick and mortar.
Yeah.
Hands down, it's still the gold standard. So we're not trying to change that. We want people to go and encounter their provider or their clinician whenever they can. But when they're not doing that, what happens? They completely fall out of the spectrum of healthcare. They don't have the information available to them to make choices about how they need to act or react. And like the scariest part about it all is if we have people that are falling very ill for something that is easily identifiable through a preventative screen, like that's a problem for us.
Yeah.
So going back to the question that you asked me, like how do you disrupt it? I don't think that you do disrupt it. I think that you complement it in the ways that you can, and just recognize that people that are going to integrated delivery networks and hospital systems and their primary care, or even their urgent care, that's great. But there's this really big population of people that are not, and so that's how you transform or complement healthcare.
Yeah, and you know, the way you describe it, access to care sometimes means access to options and access to information.
Right.
Information about your health and the potential diagnosis that you're unaware of, and making it convenient for that patient to access that information and then care after that. And that leads into remote care.
Yeah.
You know, a lot of different people, just like disruption, have their own definition of remote care. Tell us how you perceive remote care and how you define remote care for our populations that could be anywhere, whether they're in a city, small town, or rural areas. How do you define that for your teams?
Yeah, so remote care is simply defined for me as any care that occurs in a non-clinical setting, okay? What's interesting about our experiences and with what we're doing as a company, we get front row seats to the movie about all of the different ways that people are accessing care in a non-clinical setting. So I have, I work with health plans that are understanding we have a specific patient population here that we manage, and we know that they're at risk due to family predispositions, genetic predispositions, or even historical diagnosis, right?
Right.
We know that they're at risk, and we know that they're not coming into the doctor. So how do we make sure that we get an HbA1c check on Mrs. Nussbaum, right?
Mm-hmm.
Okay, send a kit to them, collect the sample, get it back. We have relationships with state departments of health where they are like in areas with high numbers of houseless encampments, right? That are going to underpasses and bridges and getting samples for hepatitis C, for example.
Yeah.
So like I just gave you both ends of the spectrum and you can imagine everything else that's in the middle of those things.
Right.
But, you know, remote care is also access to, I think it's access to information in the form of diagnostics.
Right.
But I think it's access to care in the form of an encounter with a physician.
Yeah. There's been a lot of progress made, and you mentioned COVID earlier. COVID opened up a lot of doors in terms of access to care remotely. Telehealth played a large part in that. And when I think of remote care, it's a continuum. Access to the information, diagnostics, and then access to that care, it comes after that, right?
Yeah.
And how are you seeing telehealth changing the way that we can provide that next step of care in the care continuum for our patients?
I mean, we're leaning into it. Every encounter that we support as a lab is overseen by a clinician that is licensed in the state that the person or the patient initiates a test in. You know, I was going to make a point on the last question about like, just look at the number of mental health diagnoses. And there's a lot of people that try to boil down the reasons for why there's more mental health diagnosis. But I have to imagine that it's the same phenomenon that we saw with COVID. More testing led to more increased identification of infection, right?
Right.
More telehealth leads to increased number of mental health diagnoses because there's more people that are doing it because they can do it from their home. It's destigmatized.
Sure.
So telehealth is something that we all really need to lean into. Again, it's not to transform the point of care. It's to make it available, and through making it available, you can find more indications for what you're looking for. And I think there's a really big opportunity here for legislation to occur in what telehealth looks like.
Sure.
A lot of telehealth is propped up right now through COVID regulations that what happens if that goes away? There's some risk there to the telehealth system, right?
And you're referring to the reimbursement structure, right?
Yes.
And how changes to that reimbursement structure has empowered providers to offer this access to care for our patients remotely. It's also added some capacity to a lot of our providers because instead of a person coming into your facility, now you're able to do these telehealth visits in a shorter amount of time, so you can get more done. You can see more patients in a day. Speak on that a little bit and the impacts that it could have if these reimbursement structures are held up and approved through legislation. How could that help our providers with capacity, but also, I mean, physician burnout's a big topic too. It could alleviate a lot of pressure on the provider side too.
I think it's a pretty well-known issue at this point. Let me back up. There's a lot of ways I can answer this question. I think that it's a well-established issue that primary care providers are struggling to make the business out of healthcare work for them.
Yeah.
And so when you look at what the cost of running a practice is in a brick and mortar perspective, it's really difficult for people that have defined units of time to spend with a patient. And so if you can now change the G&A portion of that business, of running that business, then arguably you can change the capacity standpoint. There's also other ways to look at that, which is, like, I just think of, you can argue this with me if you want, but
I might.
I think that, like, there's this really archaic way of doing healthcare, which is if I needed to get my lipids checked, I have to go to a doctor to get an order, to go to a lab. The results get delivered to the doctor that I have to go to again to get my results for lipids. like that's capacity constraints. It's also economic constraints for the patient, but like there's no reason to do that, but it's just the way that it's always been done. And part of it is because that's how people perceive the business of healthcare needs to run, right?
Right.
So if you can expand the care point remotely, does all of that have to occur? I think not.
When you look at other industries outside of healthcare, empowering the consumer to manage their own experience has been a trend throughout a lot of consumer touch points. And I see that playing out in healthcare, and it sounds like that's a vision of yours, probably a vision of your CEO's also. Eric Strafel was on the show not too long ago, and he has a lot of experience outside of the healthcare space. I know you do too. I bet that experience outside of healthcare has brought a unique perspective to molecular testing labs and has allowed you guys to think about how you can meet the expectations of our consumers, of our patients, that the expectations that they have are based on experiences that they get other places.
Yes.
How has that outside perspective of yours and of Eric's helped form that vision?
Yes. So great question. This is a really great place for me to put a shameless plug in for the quality of my partners in this business. 3 of my partners came from the semiconductor and solar panel space. So when you think about like what drives culture in semiconductor and solar panel, it's innovation, right? And it's factory.
Yeah.
And so we have the perspective of what we're doing through running a lab is just the same thing as running a factory, how to build capacity and expand and scale, right?
Yeah.
So I think that that's a really great foundational point to our company is that those 3 partners have that experience, right? I got into this business from the perspective of I love healthcare business models with declining ASPs. Now, to explain that a little bit, I've always found myself in these businesses where it's good for healthcare, there's money to be made, and the intersection of that is great for everybody, right? But when there's money to be made in healthcare, there's always this process in healthcare where the money gets kind of squeezed out, right?
Right.
And so that's the declining ASP that I'm talking about. Typically, when the ASPs start to decline, regulation starts to increase at the same time. And so you get this really neat convergence where there's declining ASPs, there's increase in regulation, so you know what the rules are and you know how to play in the sandbox better. And it also pushes out bad actors, right? Yeah. That's how I found myself into the lab space. There's market share leaders that are massive in the space. It's really hard to be a small lab that's innovative, right?
I bet.
And it's really hard to be innovative and get paid for innovation. And so, but that was the challenge that I wanted to try to figure out. What I have found out is that no longer is what drives me in this business. What drives me in this business is the idea that you can run a healthcare company and you can access people that are in the margins. In other words, like we have a big heart and a big culture at Molecular Testing Labs, and so our heart is focused on people that are in the margins that are not getting access to healthcare, right? And so we have a lot of unity on that value in our company. And so that, to get to the point of Eric, Eric came from the perspective of aerospace,
right?
Okay. So highly regulated industry.
I was going to say, there's some parallels there.
Highly regulated industry, just like healthcare. And, he was focused on business equity at the same time. So Eric comes into our company. He has been running strategy for Boeing for several years. So he brings a Fortune 50 strategic perspective into our company that is just naturally a good fit for us, right?
I bet.
And then on top of that, like his heart is focused on business equity. And so the first thing that he did in the first, 30, 60 days was have a roundtable with every single employee in our company. And I just love this fact about him, right? We have 250 employees in our company. He spoke to every one of them, either one-on-one or through a roundtable.
Wow.
What do you like? What do you not like? What do you see as areas for improvement, right? This is like frontline leadership.
No doubt.
At its core. So naturally, the employees of the company have a lot of trust in him because they say something to him, he's listening. What is the action? Let's just watch. Like, what is the action that occurs from that point forward? And because Eric has experience where he has benchmarked what performance looks like against Honeywell and L3 and Raytheon and 3M and all of these massive companies, he leaves that meeting and he already has the answer for how he's going to solve for the problem, right? And so we can create like rapid action and growth in the company, which is also really exciting.
Yeah, it's got to create some great culture too. I mean, now you're giving everybody a voice, a platform to have their input and their impact on the company as a whole. That's got to be great for culture.
Yeah. You want me to speak on culture?
I'd love to. Yeah, I want to hear more about it.
I'd love to. So I said this at a leadership retreat that we had where we are taking people that have become managers in our company and we're training them how to lead, right? And at the end of it, I got to say this, which is one of the tenets of my life, which is the values of your heart dictate the culture of your life, okay? So we have all these values that mean a lot to us at Molecular Testing Labs. Unity is the one that we pick on the most. Like, I got this just really soft spot for unity because I believe that through unity, it is that value that will define the culture of the company. It's the value that aligns everything else. So if you believe and you're unified in the mission and the vision of the company, which is to increase access to testing and increase affordability, meaning decrease cost, right?
Yeah.
So if you're aligned on that unity, then it's going to drive everything else that we do, okay? It's going to drive compliance and ethics and integrity. It's going to drive this belief system that, like in our business, it's in an amazing way, it's linked that every dollar equals a patient, right? And so it doesn't matter if you're running a business or not. The idea that if I'm in a sessioning and my job is to look at every sample that comes through the door and enter it into the system and get it to the right lab, if I know that that's a patient and I'm unified in that approach, then it's going to drive high-level performance and care about what we're doing as a company.
Yep. I mean, that patient focus is powerful because in healthcare we have a unique advantage when it comes to that. You're working with and helping individuals, and I'm sure that drives unity and performance. But I've got to say, the unity perspective, I think you mentioned athletics earlier. I think it probably comes from an athletic background too, because in sports, everybody's got to be on the same page. You got to be working towards the same mission. Everybody's got to be on the bus going to the same destination. In business, it's the same.
There's no doubt about it. And to that point, culture it's really hard to explain, but it's easy to feel.
Yeah.
And so, when we're recruiting people that came from Boeing, I hired a business development director recently that came from LinkedIn. Like, these are companies that really focus on culture, and they spend a lot of money on culture, right? Building that culture. But when those people come into our company and realize that there's something different and unique about it, then I know that we're accomplishing the culture aspect of this.
Yeah, and I think you're on to something. We were at the Dallas 100 event here recently. Almost every CEO that accepted an award talked about the importance of community and the importance of culture to drive performance.
Yeah.
And you're talking about some of the fastest growing small businesses in the DFW area, and they talked about little outside of community and culture. It's easy to say, it's hard to accomplish.
Yeah. Anymore, I think one of the biggest differentiating factors of companies is how they move the purpose needle for their employees. It's not the norm anymore, at least from my perspective. And it's not the end all be all, but from my perspective of growing a company from 40, 50 employees to 250 employees over the last couple of years, people are looking for purpose, and everybody has a needle, and they want that needle to move. And I think that there's an understanding that a clock in, clock out mentality is no longer a healthy mentality, and people want to embrace something.
Yep.
So how do you align yourself with purpose, or how do you accomplish that purpose? It's to have a mission. So right now, I spend a lot of time in every single person that I interview right now. First question: what's your purpose? What's your passion? Why do you have it? What is your personal story of you, yourself, or your family, of where you've been let down by the healthcare system? I think that's a really important thing to understand about somebody.
Yeah, and everybody's got a story.
They do
too.
It's amazing.
Yeah. Well, we're talking about how you're advancing performance, and we talked a little bit about, earlier on the traditional experience of accessing care and diagnostics. Even with all of the existing innovation and technology that molecular testing labs and other companies are providing, there's still plenty of challenges. Mm-hmm. There's a lot of different communities that you have to engage and educate and align with. I mean, you're talking about the patient themselves, the provider, government, mm-hmm. Payers and insurance companies. Tell us how you're bringing those communities together and aligning your services, your products, to provide value to those different communities to solve some of these challenges.
Fortunately, because of what we do, we have a really broad customer segmentation. So when I look at my customers, it spreads across retail, distribution, state departments of health, academic university research, community-based organizations, care that is occurring in clinics, and just about anything that you can imagine beyond that. So we get a lot of different perspective from our customers about what they need. It's helpful. We have a good understanding of what the personas are of each one of those customers so that we can meet their need, value proposition, right? But then it's about taking the needs for the assays and development and all of the enablement tools like APIs and digital interfaces and ordering platforms and resulting portals and all of that, with R&D, with logistics, because we have to get kits where they need to go to meet the person where they are.
Supply chain hadn't been a problem, I bet.
Not at all. Whole nother question. But I mean, we have to put all these pieces together, and then we have to apply it to a strategy. And in our case, there's a lot of opportunity for legislation right now. You have to think about where the legislators are getting their information. Legislators, and I've been able to talk to a lot of legislators. I've talked to House members, I've talked to Congress members, generally all focused around telehealth and remote care.
Okay.
Because this is something, what we're doing resonates with them.
Oh yeah.
But they don't even know what we do. They never heard that this remote diagnostics is something that can pair up with remote health. So when I just asked the question to them, is it logical to think that somebody that is accessing their care through a telephone is going to go to a brick and mortar lab? Is that logical? No, it's not logical. So how do we fix that? And part of the answer to how we fix that is bridging the gap in legislative language. It's hard to change law.
Right.
It's time consuming, and there's a process for where that can occur. And so until the flashlight gets, spotlighted on this issue enough, there's just no impetus for change. And so you have to just position yourself as a resource to lawmakers so that they understand when it comes time to write language for consumer-initiated healthcare, what does that look like? And they're not going to get those answers from traditional healthcare, from big healthcare.
Right. They're
going to get those answers from innovative companies like us that are doing it a little bit different. And so we just have to position ourselves to always be there, ready to support with language and changes to language that are enforceable. Because at the end of the day, if if small innovative companies focused on telehealth or remote diagnostics can't get paid for their services, and there's no market here, then there's no business and there's not going to be innovation.
Yeah.
So tons of opportunity in this space to educate, to bring people together, to strategize, create coalitions, create this unity in government, in regulators. I'll give you, sorry, I just want to give you this story. I want to hear it. Okay. Part of my concern for my own company is that we support research at nearly every single academic institution in the U.S., especially those that are reputable.
Yeah.
So we have agreements with Hopkins and Harvard and Emory and UNC Chapel Hill and UCSF and UW and Northwestern, like all of the greatest public health minds. George Washington is another. All of these great public health minds that are creating these massive studies to look at how can you create access points to those that are marginalized, okay? And we're talking about really subset populations, okay?
Yeah.
So how do you get access to them, and how do you create it in a engagement type platform that creates reproducible results? Because remember, good outcomes in healthcare take a lot of time to develop and to prove out. Yeah, time and data. So we're doing all this great research, and all the time the research comes out and it says, remote health is a great way to access that marginalized subset population, okay?
Yep.
Well, meanwhile, like when you look at where the bulk of our business comes from, it's coming from online consumer platforms that the primary patient is middle-aged, white America. And to me, that's a big problem, right? Fortunately, I've been able to be on conferences and get to speak at CDC roundtables related to remote health and just increasing access to that, which I'm really flattered by and just so appreciative of every time. And I come at them with this same message of, if all of the data and the studies are showing that we can increase access to care for this community, but we're focused on like the actual business opportunity as those that can afford it, or those that arguably already have insurance or you know care, like how do we bridge this gap, right? And so the only way in my mind that gap gets bridged is through public-private partnerships. And so I'm constantly pushing on this opportunity for there to be these ideas where we're doing things a little different. I'm a privately held company. I'm not focused on, you know, going IPO. I'm not focused on the sell of the company. I'm just focused on the mission. So how do we take, you know, our purpose and our mission and apply that to a public health problem? It's going to take public health dollars.
No doubt.
And so there's been, you know, I don't want to undermine anybody, because with COVID, with monkeypox, there's like public health assets are under strain in this country right now. And so I'm not demeaning them in any way, but we have to get creative about how to turn some of these parts of the solution into the full puzzle that can then be applied to the full problem.
Yeah. Education seems to be key. I mean, you've talked about legislators, you know, getting the right education from the right sources. You've talked about these speaking engagements, aligning public services with what you can help with, even down to the patients and the communities that are underserved, and themselves even perceive that they don't have access to services that companies like you guys provide. You have to educate a wide range, a wide spectrum of different communities. How important is education for you? I mean, and what channels are you providing that education to the different communities that need to know the truth and need to know what options are available?
Yeah, another great question. I mean, you know a thing or two about marketing, right? The marketing in this case is education. It is creating resource, it's creating white papers and case studies and all the things that prove what we do. We launched non-clinical remote diagnostics in 2017. And I remember thinking, well, this feels really logical to me. Like this is going to be easy. And sometimes innovation doesn't meet market timing or
Right.
market need. And so we were a little bit early. And so the education was me trying to convince people why this made a lot of sense. There were some early adopters, and the folks that were early adopters in 2017 getting into remote diagnostics have done very well. And like high tides raise all boats, right?
Right.
So fast forward to today, I'm not convincing anybody anymore of why they should adopt remote diagnostics. It's pretty intuitive. Again, COVID helped that,
No doubt.
and it really accelerated it. But we were doing it for, 3 years before COVID happened, so we were well situated for COVID when it did happen. So I don't spend time educating potential customers why it's important anymore. So that feels like a win.
Good.
I find that our legislators are really open and receptive to understanding more about this because it's logical. Like we talked about at the beginning of this
Right.
conversation, it's achievable, it feels simple, it feels cost effective. So like all of the pieces are in place to utilize this. So I think now it's about marketing the educational aspect to future customers, future patients, consumer-initiated testing. Let's just make the marketing and the education about how we empower lives so that they can get information that they need to have a healthy lifestyle.
Yeah, and something that always comes up on this podcast, and it's never in the notes, but it always comes up. It's, no margin, no mission. And what we have discussed today and the communities that we've talked about, empowering patients with this kind of information and access to this kind of care improves margin for everybody, even the patient, right? I mean, it's less of a financial burden to manage your own diagnostics in a remote setting, have access to these supplies and these products. It improves capacity for providers. We've talked about that and what that could mean for their margin and their cash flow. And then the insurance companies that have such influence in this space, there's challenges there still, but it could help them identify a problem earlier, which would then help them avoid a big catastrophic health event of one of their members, which then would put additional burden on them. So what you're describing would improve that margin and mission accomplishment for really every party that's involved.
It feels like a no-brainer, right?
Yeah.
Like when you frame it in that way, it feels like a no-brainer. I've never worked at a health plan, so I don't know all of the thinking that goes into running a health plan.
Sure.
I imagine it's very hard. Okay.
I can imagine the same. Yeah.
My experience though in calling on health plans and working with health plans is they are, like it or not, running a business that they have to figure out how to support. And like all of them have a very keen awareness for how long they keep their patients engaged as a beneficiary, right?
It changes every year.
Well, there's a lot of data around how long, when you look at your managed Medicaid populations, there's really fast change, right?
Yeah.
When you look at your large commercial payers, there's less change because unless the employer changes their policy holder or the person loses employment, they're going to stay with that plan for a pretty extended period of time.
Okay.
But all of these plans know exactly how long they maintain their beneficiaries and exactly what the averages are. And so in the business world, you have to be thinking about what the ROI is. In my mind, it's really simple that some of these pieces that we're putting together are the backbone and infrastructure for a preventative healthcare system, which feels really good and feels really right for our nation, right? Identify infections and disease early so that you can make treatment decisions.
Yeah.
My opinion, free and appropriately priced, is that decisions at the health plan are being made based on how long they're going to keep the patient involved, and so it's hard to think about paying for preventative care for some of them. Now you're going to see some of them really lean into it,
right.
And they're going to understand this conversation. This is going to be really intuitive for them, probably the market share leaders in health plan space, but like they're going to get what preventative health care means to them because they have the number of lives to justify the ROI. But the plans that are smaller and have a really quick turnover rate with their patients are going to always have a hard time justifying paying for prevention. So I think, going back to my points earlier, is it's probably going to take some legislative change in order to enforce that. And then it's a matter of, like, once that language is created, is it enforceable?
Yeah. I don't want to put you on the spot here, but if you could, there's a lot of talk about value-based reimbursement and value-based care. How, in your opinion, how would that affect some of those smaller plans when implementing, this more of a remote care approach? If value-based care was implemented to a higher degree now?
Yeah, I'm not the expert on value-based care, so I should probably just avoid that.
Okay. Yeah, and
question.
I didn't want to put you on the spot, so I apologize there.
No, it's okay. I have some things that I could say that are not educated enough to put it on film, right?
Well, I admire that approach. I would say something that I would regret later. I do often.
Yeah. I mean, I think in general, like, you can just look at concepts of value-based care and understand that it's good.
Yeah.
Paying for bad outcomes, not good. So
generally speaking, yeah.
Generally speaking, I mean, I a long time ago, I was in the spine market, and in the spine market, the saying in the spine market is, do you know, like, if you look at a market, do you know what is the single most significant driver to spine surgeries in a servable market? It's the number of spine surgeons. Okay, so what does that tell you? It speaks volumes to me about why a health plan or why legislators would want value-based care, because it should not be based off the number of surgeons. It should be based off the needs and the indications, right? And depending that all, apples to apples, one per capita equals the same other per capita in terms of obesity and smoking and all the other risk factors that generally lead to spine surgery. Like, as long as those are pretty comparable, you should have the same rate of surgery. So
I got you.
The point being, like, value-based care makes a lot of sense to me. Don't need to pay for unnecessary surgeries that could have been prevented through preventative care.
Right. So where do you see us going in this remote care approach? If we were to look down the road, 5, 10, 15 years from now, how do you see this all coming together? Is it through legislation? Is that the big domino that has to fall?
No, look, I think that this is a parallel path. Legislation is certainly a portion of it. We have to put rules around what best practices are. And I think that the problem that we have right now is that we're really new to market. And so best practices have not evolved. We have a very high focus on compliance. We look at every payer. We understand what their medical policy is. We understand why they create that medical policy to govern good decision-making amongst clinicians and practitioners, right? And so we were one of the first people in this space, and so we had to, through just being smart, just being proactive in our thinking, like, what is a good engagement and a good encounter, right? So one of the things that people don't understand about what we do is, for every lab that we run, it might be consumer initiated, but there is always physician oversight involved, okay? Meaning, if the test is ordered in Tennessee and we need a clinician that has licensure in Tennessee, we don't supply that. The channel partner of ours has to supply that so that they have a physician order. We have a rec number that says That was ordered by a physician.
Okay.
We then would result back any kind of abnormal or unexpected result back to the clinician. And the importance of that is that there's an opportunity to link the patient to care. And most of the channel partners that we have are very niche based, like they're focused on a specific indication or a specific patient type. And so they know how to handle that patient, right? And how to link them to care. And so ultimately, like, we put all this into place without anybody saying that's how that has to work. We did it because it's the smart way to make it work, so that at the end of the day, the patient is linked to good care. If it's a infectious disease or communicable disease that is required to be reported to the local health jurisdiction for follow-up and linkage to care, we do that as well. So I think the opportunity is, like, where do we go 10 years from now? I think there's a defined best practice. I think that there's a lot more regulation around what we do, which we support.
Yeah.
Because you can't put bad tests into people's hands and give them bad results and expect that that's going to be good for the outcomes.
Right.
We believe that in 10 years, there's a lot more data. I look forward to engaging pharmacists more. I think that in 10 years from now, that's a really big opportunity for us to engage pharmacy into some of the healthcare that's occurring right now. I think that consumers are much more savvy. Look, we do the majority of our testing on dried blood cards right now, which means someone takes a Lancet finger prick, drops that onto a blood card.
Yeah.
In 10 years, there's a better way to do that, right?
Probably right.
Technology will evolve. There will be PCR-like machines, in the home at that point. We've already seen it happen with COVID.
Yep.
So it's a natural evolution. So just like in the last 10 years, we have evolved light years from where we are now. In 10 more years, I just think that technology curve will accelerate even faster.
I 100% agree, and I'm glad you talked about the last 10 years and the light years that we've traveled over that relatively short amount of time. There's this negative perception out there about healthcare and how slowly healthcare evolves and moves. And that might be true in some ways, but I don't think healthcare gets enough credit for the challenges that the industry's overcome recently and the curveballs that it's had to hit, especially in the last few years.
Yeah.
And then the smart minds, innovative thinkers that look back on those challenges and go, we learned something valuable from that, and we can implement enhancements or innovations that will prevent it from being such a negative impact in the future if something like it were to happen again. And I'm thinking of COVID.
Yeah.
And so that's one of the big reasons why I wanted to do this podcast, is because give healthcare the credit. There's really smart people working on some really hard problems, and the proof is in the pudding. The last 10, 15 years has been night and day when you look back, and it's really exciting when thinking about how we can empower clinicians, practitioners, empower patients to have a better healthcare experience and drastically improve the outcomes of our general population.
Mm-hmm. Yeah, there's no doubt. We said it once before, but I think it's worth repeating that healthcare requires trust. It requires trust, and trust builds over time. And so if there's any kind of lethargy to healthcare, I think that it is that it requires trust.
Yeah.
Which is fine, but it may not be the actual healthcare system that is dragging it or slowing it down. It could be just patient trust, right?
Sure.
It can also be that good outcomes take time to build and to prove out. Yeah. And so, medicine is interesting because we don't like to think about things that are logical. We like to think about things that are proven by data. And so it takes time to build up that data set to prove good outcomes, and then the good outcomes builds the trust, and it's just a revolving cycle, which ultimately, pushes the market forward.
I couldn't agree more. If there was one thing that you wanted to reiterate, or if there's one thing that we haven't touched on that you want these listeners to take away from this conversation, what would that be?
I think it is that remote healthcare is certainly here to stay. We have proven out so many use cases for why remote healthcare is important and valuable to all parts of the population.
Right.
And so let's all lean into it. Let's figure out how to make it better. I think the opportunities here are mostly patient-centric. Let's figure out how to get it paid for. Mm-hmm. Let's figure out what the best practices are. Let's figure out how to create laws and rules around how providers that are engaged in this space are supposed to operate, so that there's no blurry lines about what you should and should not do.
It's going to take a village.
There's no doubt.
And that includes the patient. The patient has to buy in and trust that it makes sense for them, their health, their wealth, and their well-being. I can't thank you enough for being here.
It is my pleasure.
It was a pleasure of mine too. And
thank you so much for having me.
Yeah, glad you were here.
Appreciate it.
Thanks, everybody.